Thank you, thank you. It is my pleasure to introduce everyone to Mike Higgins. He's a highly recognized business leader with an extensive experience in strategic business development and corporate leadership. He currently serves as the Senior Director of Regional Strategy and Planning for Springfield Clinic, a 600-plus provider organization in downstate Illinois. Mike is also the founder and a consulting partner for Simplicity Strategy and Solutions, LLC, a company that focuses on assisting companies for all of our strategic planning, as well as identifying areas for improvement within existing business processes, and the founder and owner of Simplicity Properties, LLC, a property management company. Prior to his current roles, Mike served as the Chief Operating Officer for Peoria Surgical Group, PSG Realty, and PSG Investments, as well as several executive roles within OSF Healthcare System, including 2 separate tenures as interim president of the Children's Hospital of Illinois, executive director of the OSF Healthcare Foundation, executive director of Research, Innovation, and Education for OSF Ministry Services, and the executive director of business development for OSF St. Francis Medical Center in Peoria, Illinois. Before his career in healthcare, Mike worked in the insurance and financial services industry for 14 years. He served as vice president of the Wyman Group, a local brokerage firm where he developed and grew the property and casualty and financial services divisions from the ground up. Additionally, Mike worked in claims for State Farm Insurance before becoming an agent and financial advisor for Country Financial. Mike earned a bachelor's degree from Eastern Illinois University and an executive master's of business administration degree from Bradley University. Mike was recognized by Inner Business Issues magazine as one of the 40 leaders under 40 and is a graduate of the Peoria-area Chamber of Commerce Community Leadership School. Additionally, he has dedicated himself to charitable and community organizations, serving on numerous boards of directors. He has been married to his wife, Tiffany, for 25 years. They have 3 children, daughter Allison, 22, who currently attends St. Louis University Law School, and twin boys, Andrew and Connor, both 18. It is my pleasure to introduce Mike Higgins so we can learn more about Springfield Clinic in Peoria, Illinois.
Okay, let's get a couple things straight. First of all, there's this much attendance because of breakfast and the pie throw. Yeah. I'm no dummy, I know that. So, I really appreciate the time to kind of go over some things about Springfield Clinic. I also want to mention one thing about Tom's story. So it kind of all comes together a lot of times. My dad and I took a trip with him to Cooperstown, and I actually stopped in a town called Corning, New York. Corning, New York no longer has a minor league baseball team, but my dad played professional baseball back in the 50s for the St. Louis Browns organization, and also for the Indians, and he played for Corning, New York. So we tried to find the place where the baseball stadium would have been. We didn't find it, of course, but it was one of those things where he was pretty teared up by that. But how it comes back around is he passed away in November, and Barracks actually catered his celebration of life, so provided some comfort food for people, and so we really do appreciate that as well. So. That was a good trip, and it was tough for him because he was 80 plus at the time and had a tough time getting around, but it was a good memory. So I appreciate you for that, Tom. All right, here we go. So I'm going to tell you about Springfield Clinic. It's probably one of those things that you guys have said, God, I see these signs popping up everywhere. I don't know what the hell that is, and I get that a lot too, so I really do appreciate the opportunity to present that. I'm a pretty active speaker. I'm going to try to stay behind the podium so that you guys can hear me. So I'll struggle through to make that happen. So
Your clicker is right there for you.
Yep, got it. So what is Springfield Clinic? So what I want to do is I'm not going to stand up here for 45 minutes and give you a long lecture. I'm more interactive. So I really just want to kind of give a 10-minute overview of some things about the clinic to really give you kind of an understanding of it. And then I'm going to open it up for questions. Myself or Tracy Leisman will be happy to answer any of those questions either now or even afterwards. Or we have 17 different ways to be communicated with now, trust me. My phone has been blowing up with about 15 of those ways. So you can always just reach out to us and we'd be happy to answer any questions or provide any insight that you need. Okay? Quick overview of the clinic. So Springfield Clinic started in 1939. 1939 is, if you do the math backwards, we're in our 85th year. We were one of the first multi-specialty physician clinics in the state of Illinois. And also, we are the oldest medical corporation in the state of Illinois. One of the stories I like to tell about that is from my bio, you know that I really came over from Peoria Surgical Group. When Peoria Surgical Group merged with Springfield Clinic in 2020, it was the two oldest medical corporations in the state of Illinois. At the time, 81 years for Springfield Clinic and 67 years for Peoria Surgical Group. So total, that's 148. It's almost 150 years of medical experience that came together at the time. And I often laughed because it was Medical Corporation 1 and 2 that merged together. So there is a long tenure. It started in 1939 with 5 physicians in Springfield and has grown substantially since then. We serve over 2 million patients, and I will, in one of the next slides coming up a few down, it'll show you, for those of you that are visual learners, it'll show you a map, and I'm a visual learner, so it'll kind of show you a map of our geography, but primarily in central Illinois, but it is stretching as we continue to grow. We have over 3,500 employees now. Those are spread out, throughout our geography. 90 locations, and I'll break that down a little bit in a few minutes. And then we do have, it says 650 plus, we're being modest. We are getting close to 700 providers. When I say provider, just for those that are not physicians, and by the way, just as a side note, I know that Dr. Miller and Dr. Albers may have come here to heckle me later, so you guys are probably entertained by that, former colleagues of mine. But we have almost 700 providers. A provider is really a physician, but also a provider is going to be an advanced practice provider, which is a certified nurse anesthetist, advanced practice nurse, physician assistant, so those that are more of the mid-level providers, sometimes they're called. So we have almost 700 of those. Of the almost 700 providers, about 400 of those are physicians. And then of that, about 360 of those physicians are actually partners or owners in Springfield Clinic. And I'll kind of break that down pretty soon as well. Couple things about it. We have physician leadership. So when I say they are owners in the clinic, they are truly the owners of the clinic. They not only own the clinic, they lead the clinic. We have a 12-member board of directors that are all physicians that make decisions on a monthly basis. Multiple committees under that that actually handle many of the things, facilities and finance and all those things, good things with the medical corporation. So the physicians that are owners get a really good chance to be part of the business itself. However, they can't do it themselves, so there's people, minions like me that come in and help them with different parts of their business. So we do have 14 person executive team plus others that are, kind of down the ranks from that. Our CEO is Ray Williams. He's been with us for, I think, around 7 years now. And our chief medical officer is Ken Sagans. So this really entails helping, synergistically working with the physicians on all those things that businesses need: finance, marketing, IT, HR, all of those different things. So it's really a relationship between the physician owners and what they want to do and the administrative leadership that helps execute on that. We have primary care providers and specialty providers in both this market and throughout our geography. It's about a 30-70 mix. So 30% are primary care providers. Those are going to be internal medicine, family medicine, pediatricians mainly. And then we have about 70% of our providers in the clinic are specialty providers amongst almost every specialty there is. There are a few that we are missing that we are still recruiting for, but not many. We cover pretty much all of the specialties throughout the medicine. 3 pillars of Springfield Clinic. A visual, for those of you that like that, the Olympic rings. If you ever look at the 5 Olympic rings, they all intertwine, they touch each other, so none of them are separate. That's really how we see as our 3 pillars. Improving health, providing value, and serving the community. What I mean by intertwining, we want to make sure that patients, we're taking care of them. That's our first and foremost priority. But also at the same time, we want to take care of them where they're at. We want to take care of them and provide value to that community, and we want to keep that care in the community. One thing we do not do is we do not try to pull cases from a rural community to Peoria or to Springfield. That's just not our MO. We want to keep it there as much as possible unless it has to come to a higher acuity medical center in one of those areas. So these are really the things that we focus everything around at Springfield Clinic. As promised, here's your map. This is how I learned. This is our current geographic stretch. As you can see, it goes east to west, anywhere from Champaign-Urbana and Danville over to Quincy and Carthage. And then we do have an outreach location in Princeton, all the way down to a location in Flora. So how I describe it sometimes is it's a sideways football. But it is the majority of the middle of central Illinois. We do have an extensive outreach program. So we have, over 250 clinics within about 50 outreach locations. So there's primary locations where these physicians are housed, but then they will go, once every 2 weeks or once a week to an outreach location. And a lot of times that's in a rural critical access hospital community to try to provide some of that specialty care there. Another big thing, and this is really prominent in the central Illinois area, is our hospital partnerships. So we don't just look to come into a market and just cannibalize the patients or the services there. We look to partner with hospitals. So we have partnerships with hospital systems, many growing relationships with them, including OSF Healthcare, Carl in this community, HSHS, and Memorial in some of the more southern communities. But we also have relationships with almost all of the rural hospitals. Most of those are critical access hospitals. They have limited services, so we continue to focus on building relationships with those providers. I have conversations with them on a monthly or bi-monthly basis with almost every one of those hospitals. So it's important to us that we're partnering with them so that we have a relationship where if they have a need on something, we're going to try to help provide that for them, so that, because it's oftentimes hard for them to hire the physicians that are needed on their own. So if we have those and we can bring them in, it's absolutely what we want to do. All right, so here's why you came. What's happening in Peoria? This is a pretty extensive list. I have another page of this too for Morton and Pekin, but we really started at the top there with Springfield Clinic Peoria with our surgical specialties, and that's how we kind of had what we called a big bang with Peoria Surgical Group in August of 2020. Since August of 2020, we have added all the rest of those, including dermatology, allergy and asthma. We just brought on Teverball, Crolin, and Mueller, which is the largest OB practice in Peoria. They're about 60% of the market. And, we have a lot of other partnerships. We have breast surgery that we partner with Carl. One of the ways that we partner with OSF is, and you probably may have heard this, it was in the media a little bit last week, is we actually have a partnership with OSF Healthcare for OB in our North Knoxville location off of Lindbergh. So that is our providers, our OB/GYN providers that are coming in and providing care for the OSF patients. Some of those OSF patients, really more than anything, it's going to be the OSF employees. Because of how some of their insurance happens, we don't want them to have to be what we call tier 2 and have to pay extra money out of pocket. So we partnered with OSF to help them get the care that they need at the least cost out there. So we've grown quite a bit. I think in the Morton Peoria market, we have around 8 locations, I think. No, actually, if you include Morton and Pekin and Bloomington, we have 12 locations. So we've really grown into almost 60 providers, 12 locations in 5 separate markets in about 3 years. I would give you information on who we think is coming up next, but I also may or may not have confidentiality agreements with them, so I can't mention any of those. But Morton, we also have locations in Morton. We have 4 really good primary or pediatricians in Morton that they rotate between the Morton office and our Bloomington office. So they have a really good stake in that market. We have an internal medicine doc in Morton as well. And then we just started we have general surgery services in Pekin, and we're going to look to grow some of that to serve an underserved market. And I will finish with this one, and then we're going to open it up for questions. This is the big one that most people see now. It has what I call a BAS. And for those of you that don't know what that is, when we first bought Peoria Day Surgery Center, and we said we're going to put $12 million into it, we've actually put $18 million into it. When we did that, I was on one of the first calls after we closed that deal, and they said, you know, what's the most important thing you need? And I said, I need a BAS. And they were like, what's that? I said, we need a big ass sign. And we have several of them. So we have several BASs out there. But we really did this because it's not that we wanted to take business, right? So I think a lot of people say, well, you partner with hospitals, but now you have your own surgery center. It's not to take business away from them. It's really to provide some additional resources for surgery for patients in this community. Less infections traditionally, nationally. It's a lower cost as well to patients. And honestly, this location is what I call bougie. This place is incredible for patients. It also has with it, with the certificate of need that came with that we took over, it has 6 recovery care beds. So those are no more than 72-hour stay beds. So we can do some more high acuity cases here because it's not just an outpatient center. You can actually do some higher acuity cases, have them stay all night. One thing that this really irritates me about this is that the TVs in the patient rooms are bigger than any television I have in my house. And I still cannot get over that. It really irritates me. So my wife's going to have to pony up for a TV. But this is a really nice location, and it is an option coming up. We should have all of our licensing, all of the red tape with the state done by mid-March, mid to the end of March, and we'll be up and running fully. So I wanted to give you a quick overview, but the devil's in the details. So I will open it up to questions that any of you may have at this point.
Hi, Mike. So excited to have you. So I work at Illinois Cancer Care. We followed Springfield Clinic really closely because those are some of the best surgeons in Peoria when it comes to cancer treatment. Can you give just a little insight onto what was going on with Blue Cross Blue Shield and the access? I guess I come from an accessibility piece. We want our patients to have access to the best surgeons, and it shouldn't be based maybe on what the hospital they're affiliated with. Will OSF and Carl cancer patients be able to have surgery at the surgery center? How does that work with your surgeon?
Yeah, absolutely. So that's one of the biggest questions we've had. So for those of you that aren't aware, about, it was October, November of 2021, I'm going to give you generalities because I don't want to get sued by Blue Cross Blue Shield. Essentially, they offered to reduce a rate for one of our plans, and we chose not to do that. And the reason was not because out of greed by any means. It was out of really protection for some of the hospital systems and also for a lot of other independent providers. Right? We just could not accept taking such a high cut. So we told them we'll just drop that plan. Well, it escalated quickly, and Blue Cross Blue Shield said, okay, no problem. Well, then you're out altogether, and thinking that we would cave and we would come back quickly. We probably sent them some derogatory fingers and signals, and everything just went out from there. So we were out of network with Blue Cross Blue Shield for just over 2 years. This was disruptive for our patients. It was disruptive for our providers. But we were not about to give in. The reason is because if we give in on that, if the second largest clinic and providers, independent provider clinic in the state gives in on that, it opens up the field for rural hospitals, all other independent providers. So we hung with it. We did settle with Blue Cross Blue Shield. We have a 5-year deal in place with them. We're very happy with it. So to answer your question, the second part of the question, yes, we are back in network. Those patients, cancer patients specifically, can not only see the Springfield Clinic surgeons at the surgery center, or if they need to go to OSF to have surgery, to Carl, yes, it is wide open at this point. So we're elated that we're back in network and we can continue to take care of those patients. One side note on that, and Tracy knows this because she's been part of a lot of it. What we did is when we went out of network with Springfield Clinic, we actually, my department specifically, actually started shifting gears and saying, okay, because I oversee several parts of the clinic. One is affiliation, so new, like TCM, T-Herbal Carl Mueller, when they wanted to come over, I helped facilitate that. But I also oversee our outreach program. So we really shifted gears because we were getting less people that wanted to join the clinic because it wasn't as, it wasn't as lucrative at that point. And they didn't want their patients to have to make that cross. But on the outreach side, we started contracting with what are called professional service agreements with hospitals saying, okay, you essentially lease our physician, then you're able to do all the billing under Blue Cross Blue Shield. We put in over 35 PSAs throughout the state in multiple specialties to try to help the access so that those patients weren't just out of network. So we really kind of pushed that forward. And then once we got back in Blue Cross Blue Shield, everything kind of switched for me. But so we're trying to do what we can to make sure that those patients have access and they don't have to pay additional out of pocket.
So thank you so much for being here today and talking to us. It seems to me that you came into and upon the market quickly, maybe not, but it had to affect the hospitals tremendously, what you were doing.
Yeah.
And so one of my questions is why? Why did you do this? And then the other thing I believe I heard was you're more cost effective, and if you can explain that. So thank you.
So the clinic over the last probably 7 to 8 years has grown exponentially. Peoria was a market that we were looking at for a long time, and Tim can speak to this as well, because I worked at OSF and I was on the other side of it, right? For a long time there was an unwritten rule that Springfield Clinic, you stay in Lincoln and south of that, and OSF will stay north of it, right? It was kind of just an unwritten rule. So when we had an opportunity with Peoria Surgical Group, and honestly, I was with Peoria Surgical Group at the time, and we went down to have a conversation with Springfield Clinic because we knew a few of those people, and really it was not about affiliating. It was about, hey, you guys have figured out some ways to work cohesively with both St. John's and with Memorial. And how the hell did you do that? Because we're struggling between what at the time was Uni Point and OSF, and so we talked to them a little bit. And then we started asking them, so tell us about your model. Like, how do you guys, what happens? And we were intrigued immediately. It was a tough decision for Peoria Surgical Group to make that jump. I think Springfield Clinic was probably a little tentative and hesitant about coming into Peoria, but they had an opportunity to get a large surgical group that had a pretty, probably the best reputation in town. That is really the reason. They've always eyed Peoria as an opportunity because we felt like there was an opportunity to serve more patients as far as an access, right? It's easier to get in if you have more providers. So we decided to make that jump. It was a very risky move. We look at markets now that we're entering and we say, do we want to do a big bang like we did with Peoria Surgical Group, or do we want to kind of ease our way in quietly? It just depends on the circumstances. So that's really that's the reason why. There was no like planning or ulterior motive. It was an opportunity presented and we thought we could do well. We've grown quite a bit since then. Being more cost effective, it really is about the surgery center is really what's more cost effective. I mean, we have the same insurance plans as most other providers. And so it's pretty much the same for the patient. But when it comes to some of the savings for the insurance company, a lot of times, if the surgery can be done in a surgery center, they want it to go there because it's just more cost effective for that. And if you look at some of the statistics, as I do, some of the projections over the next 10 years, the projection is for a lot of surgical care to shift over to ambulatory surgery centers such as this, right? There's several in town. So a lot of this is going to happen over the next 10 years. We're just trying to get ahead of it. One of the things I will say as well is we have Springfield Clinic has had a surgery center in Springfield, a larger surgery center than this. It's one of the most productive in the state. Because we have the providers that are actually running it, they know where the efficiencies are because they're trying to find efficiencies for themselves and their patients, right? So that they're motivated to do that. So they know how to do it. We put through over, I think, 27,000 cases through our surgery center in Springfield last year, which is a substantial savings for insurance companies for sure.
How will the individual save? Will our insurance rates go down?
Well, to that I'm going to defer you to Blue Cross Blue Shield. I can give you their number. I don't know. You know, that's a good question. I'm not in that industry. I don't know if they will. You think they would, but who knows? So.
I have 3 questions, Mike. Thank you for coming today. Number 1, do you take Medicaid? Number 2, we have a medical school here. Are your providers involved with the medical school? Do you have any affiliation with the medical school? And number 3, we have a lot of specialists, especially in pediatrics, as you know, that are not members of your group. If I'm a primary pediatrician in your group, can I refer to the specialists outside the group, or do the patients have to go to Springfield?
No. Yeah, good questions. So now I've got to try. So I'm getting older, so I got to remember them real quick. So the question about the university, we do. Our providers do have relationships with the university. They either have, as you know, Dr. Alves, they either have voluntary privileges or voluntary.
So they get faculty appointments.
We do get faculty appointments. All of them do. The Peoria Surgical Group used to be the surgical department. That has shifted quite a bit. There are still some of our members that are full-time faculty with the university as well. Most of them have paired out of that, but they do still do teaching and their faculty with the university. In fact, we have several discussions ongoing with the university right now about ways that we can continue to partner with them. Second question about the pediatricians. So yes, we're in discussions right now with Children's Hospital of Illinois, which I'm very familiar with. And we're actually talking to them about the possibility of them bringing some of that specialty care, pediatric care to Springfield. But to answer your question, we refer to those children's hospital providers, yes, regularly. They do not have to go to Springfield.
Adult specialists also.
You bet. Yep.
And what about Medicaid?
Medicaid, we do take Medicaid. Yep. Now it's we get, sometimes we have to kind of do some maneuvering with how the patients are in, but yeah, we take Medicaid. We don't turn them away.